What are the options? What are the treatment options typically available for patients who come up with a rotator cuff injuries or probably a tear? So what are the treatment options available for them?
See, as I mentioned in the past, it all depends on the profile of the patient, the expectation of the patient, and the kind of pathology they present to us with. Now, if it is a young individual who comes to us with a complete rotator cuff tear, a minimal invasive surgery like an arthroscopy, a shoulder arthroscopy, a keyhole surgery, which would fix the shoulder. Yes, minimal invasive, a keyhole surgery, arthroscopy. Nowadays, we have moved on. The sciences are so advanced. A few years back, we would have to make a big incision, open up the shoulder joint, and repair everything. But in today's date, with the advancement of technologies and the medical sciences, everything can be fixed with a keyhole surgery. So, a rotator cuff tear can be well fixed with the keyhole surgery. This is a primary treatment when patients present to us in time. As I said, a stitch in time saves 9. Now, what happens if the patient neglects his rotator cuff tear? Over the period of time, the rotator cuff tear becomes bigger. The muscle tissues lose their strength and integrity. And then the length of the tendon tissue also shortens up. These are called as the irreparable rotator cuff tears. Now, when a patient present to us with an irreparable rotator cuff tear, you cannot repair it. That means it's irreparable. Then you'll have to look into the alternative surgical options. Like we have certain patch augmentations in today's date. We have certain muscle advancement techniques. And what is in vogue today is something called as the balloon spacers, which are used inside the shoulder, which also provides a mechanical support and is beneficial in these kind of massive retracted rotator cuff tears, which are irreparable. To add on, when a patient comes to us with a neglected rotator cuff tear, which has happened many years back, and the patient is not treated in an appropriate manner, the shoulder joint undergoes a wear and tear, and that is the subset of patient who requires a shoulder replacement, particularly called as the reverse shoulder replacement, and that is the treatment lines for those patients.
What's the success ratio of the entire shoulder replacement? When you talk about the shoulder replacement, you talk about a particular, so like the entire shoulder. I'm asking a layman kind of a question.
Yeah, so when you replace any joint, we need to understand we are replacing only the involved surfaces of that joint. You do not replace the muscle, tendons, ligaments around that. You replace the ball and socket of the shoulder. And by and large, over the period of time, the technology is evolved. The materials and the implants what are used in these surgeries have advanced. And in today's date, you would say that the success rate of shoulder replacement surgeries are as much as 92% globally. So we have good results, what we call the midterm results of these shoulder replacement surgeries in terms of pain, in terms of mobility, in terms of patient compliance and patient satisfaction.
So Dr. Chirag Thonse, so what you are suggesting that if you have a pain, let's not wait for it to get worse and go to a point where you need a shoulder replacement, because before that also there are like minimum invasive surgery options that can actually help your rotator cuff injury, and that is where a lot of people delay things, and then there is a requirement of a shoulder replacement. Am I right, doctor?
Yes, yes. See, in
So all
any
those people who are listening to us, it's important for you to know that when you have an injury, it's like early, a stitch in time saves 9. Doctor just emphasized on that point. And before it gets delayed or worsens to a situation you need an entire shoulder replacement, you should visit a doctor, a surgeon, and get it consulted, get it checked.
Yes, of course. See, yeah, of course. So I mean, even before you would reach into a surgical interventions, I mean, if the problems are detected at a very nascent stage, if somebody comes with a partial rotator cuff tear, or else if somebody comes with the very early stages of sprains of the rotator cuff tendon, one could always avail the facility of a physical therapist, the physiotherapist, the strength and conditioning coach, and strengthen your shoulder muscles to probably avoid or prevent the further progression of tear. Regenerative medications, regenerative medicine in today's date is in vogue. People do have challenging results in regenerative injections into the shoulder, like PRP injections. they have healing potentials, and the partial rotator cuff tendons can also have benefits with these regenerative injections. So it's like an a la carte. You have different approach of treatment for different pathologies and what stage the patient present to us with. So the crux of the story is that one needs to identify your problem precisely in the right time to prevent any kind of a larger catastrophes.
Correct. One word that you also used was the balloon spacer procedure.
Yes.
Can you throw some light, like again, if I may ask you to explain to our like viewers who are probably needing that kind of surgery, what it is and how you do it?
It is one of the technical advancements in shoulder surgeries. What is been seen in the last decade. It's a newer innovation in shoulder surgeries. What a balloon spacer does is, as I elaborated in the past, sometimes when the patient present to us, the patient is relatively young, the patient is active, the patient comes to us delayed after an injury where the rotator cuff tendon is irreparable. What are the options here? Either leave the patient alone like that and tell him come back after a few years to do a shoulder replacement, or do a premature shoulder replacement for him at a very young age. If the surgeon feels that the patient is too early for a shoulder replacement, the patient is active, a balloon spacer which is placed in between the shoulder joint and the bone above, which gives a mechanical support and helps in the shoulder mobility, can be an alternative option, or maybe a right option in today's date in such scenarios. It's a newer advancement of treatment in irreparable rotator cuff tears.
Does that balloon spacer stays in your shoulder throughout your life, or
Uh,
is it requires like a change or repair kind of a thing?
it's a self-degrading. It degenerates over the period of time. In the sense, it dissolves over the period of time. The
Okay.
typical
Okay.
timeline is 1 year.
Okay.
But
So,
during this phase, the patient has a mechanical support there. It acts like a spacer which recruits the muscles around your shoulder and regains the mobility of the shoulder joint. So I have been doing these surgeries and they've been quite productive and fruitful for the patients. I have results of
yeah, a lot
patients.
of people were very happy about the procedure that you have done, and I was reading your your patients' reactions to the surgery and the procedure.
Yeah.
So now, like, in which cases are shoulder replacement recommended?
Shoulder replacement, like any other joint replacements, the primary indication of a shoulder replacement is wear and tear of the shoulder joint. When your shoulder joint is worn out beyond repair, that is a grade 4 of osteoarthritis, is the primary indication for a shoulder replacement surgery. Of course, there are other indications, like somebody comes to us with a shoulder fracture which is not repairable, which we typically call it a four-part fracture of a shoulder joint. That's another indication for a shoulder replacement surgery. Thirdly, when patients come to us with the irreparable rotator cuff tear and the patient is not very young, so he can be offered a choice of a shoulder replacement, which is called a reverse shoulder replacement, which is the ideal treatment lines for
Okay.
these patients. So shoulder replacement surgery has got a spectrum of indications, among which wear and tear, that's osteoarthritis, irreparable fractures, and irreparable rotator cuff tears are the ideal indications for shoulder replacement.
What do you think is the recovery period after a shoulder replacement surgery?
As I said, each shoulder pathology is different. Now, if you talk about a rotator cuff repair, ideally the patient could be up and about doing their normal activities by 3 months, and most of the patients are able to do all their overhead activities. If it's a younger individual, can get back to sports in about 4 to 5 months typically. But of course, if it's an elderly patient, you do not expect them to do certain things, so we restrict that. In a shoulder instability surgeries, like in sporting athletes who come to us with the shoulder instability and we fix the ligaments there, in those individuals the recovery is quite quick and they're able to probably resume their work in their sporting activities in about 4 months to 5 months typically. This is kind of the shoulder surgery recovery time we're talking about in a blanket scenario.